Your kidneys filter over 50 gallons of blood every single day, but some foods can silently sabotage them. Kidney stones are small, but the pain? Anything but. Certain everyday foods can increase your risk of these painful stones, especially if you're not aware of what's in them. In this video, we'll break down the 5 common foods that are linked to kidney stones and explain the science behind it. Let's start with a leafy green that's not always as healthy as it seems. Spinach. Microscopic view of calcium. Oxalate crystals forming in urine. Illustration showing needle-like crystals forming from oxalate and calcium in a urine sample. Chemical structure of oxalate binding with calcium. Molecular model showing oxalate C2O42 binding to calcium ions Ca2+ to form calcium oxalate. Cross-section of a human kidney with a visible kidney stone. Labeled diagram showing stone in renal pelvis with oxalate as the cause. Spinach leaves with oxalate content. Highlighted visual showing spinach and its oxalate concentration, maybe in mg per 100 grind. Digestive process showing oxalate absorption in the gut. Diagram of human digestive tract with arrows showing oxalate uptake from spinach. Graph comparing oxalate levels in various vegetables. Bar graph with spinach at the top compared with kale, broccoli, etc. Animation frame of kidney filtering. Oxalate illustration showing oxalate passing through nephrons and combining with calcium. Diet chart showing high oxalate versus low oxalate foods. Split panel image. Spinach, beets, nuts versus cucumber, cauliflower, milk. Electron microscope image of kidney stone structure. Zoomed in, look at a crystalline calcium oxalate stone with labeled layers. Biochemical pathway of oxalate metabolism in the liver. Scientific flow chart showing oxalate derived from dietary sources and metabolism. Urinary tract image showing stone obstructing ureter. Labeled medical illustration with pain points indicated. Impact of high oxalate diet on urinary pH and stone risk graph or infographic showing how acidic urine plus oxalate, higher stone risk. Spinach smoothie versus water comparison for kidney health. Juxtaposition showing oxalate load versus hydration benefit. Role of gut bacteria, e.g. Oxalobacter formigenes, in breaking down oxalate diagram, showing bacteria in gut helping to degrade oxalate before absorption. Patient education poster. Too much spinach? Visual warning about frequent spinach consumption and kidney stone risk. Darker 2 beets and kidney stones. Oxalate concentration chart in beetroot image showing beetroot with a magnified label showing mg of oxalate per 100 gr. Chemical bonding of oxalate from beets with calcium in urine. Molecular illustration showing oxalate molecules forming calcium oxalate crystals. Cross section of the kidney showing calcium oxalate stone formation. Illustration linking dietary beet oxalate to crystal formation in nephrons. Beet juice in a glass with highlighted oxalate load. Visual comparing 1 cup of beet juice to daily recommended oxalate limits. Pathway of oxalate absorption from beetroot in the digestive system. Diagram showing digestion and transport of oxalate to the bloodstream and kidneys. Microscopic image or illustration of calcium oxalate monohydrate crystals. Spindle-shaped crystal clusters forming in the renal tubules. Comparison infographic. Beetroot versus other vegetables by oxalate content. Bar chart with beetroot, spinach, rhubarb, etc. in decreasing oxalate order. Renal tubule clogged with calcium oxalate crystals. Zoomed in kidney diagram showing damage from excessive oxalate filtration. Visual explanation of how dehydration plus beets increases stone risk. Side-by-side hydration chart showing concentrated urine when not enough water is consumed. Illustration of a kidney stone forming in someone with high beet intake. Anatomically correct model with stone location labeled as calcium oxalate. Gut microbiome's role in breaking down beet-derived oxalates. Image showing lack of Oxalobacter formigenes leading to higher oxalate absorption. Visual comparison. Raw beet versus cooked beet. Oxalate difference. Infographic showing how boiling reduces oxalate content in beets. Patient risk factor chart. Beet consumption plus other stone risk elements. Flow chart showing how beet intake combines with low calcium diet, dehydration, etc. Labeled anatomy showing how oxalates travel from intestine to kidney digestive to renal system. Pathway of oxalates from beet ingestion. 3. Nuts and seeds and kidney stones. Oxalate content comparison chart of common nuts and seeds. Bar graph comparing almonds, cashews, peanuts, and sunflower seeds based on oxalate levels. mg 100 green. Close-up image of almonds with labeled oxalate molecules. Visual showing chemical tags on almonds indicating oxalate presence. Chemical diagram. Oxalate from nuts binding calcium in kidneys. Molecular structure showing calcium oxalate crystal forming due to nut-derived oxalates. Digestive absorption pathway of oxalates from nuts. Illustration of oxalate being absorbed from the intestines into the bloodstream. kidney cross-section with stone formation linked to nut consumption diagram, showing nephron damage or stone accumulation due to high oxalate intake. Healthy snack, almonds and the hidden risk of kidney stones. Infographic balancing benefits of almonds versus oxalate content in overconsumption. Comparison, high oxalate nuts versus low oxalate alternatives. Split image comparing almonds, cashews, peanuts versus pistachios, walnuts, macadamia, urine pH and oxalate excretion after nut consumption. Line graph showing post-meal spike in urinary oxalate after consuming a handful of nuts. Microscopic image of calcium, oxalate crystals from nut-derived oxalates. Illustration or microscope-style image of needle-like crystals in urine. Stone-prone gut, low calcium diet, plus high nut intake. Stone formation diagram showing how low dietary calcium allows more oxalate absorption from nuts. Dehydration, plus nuts. Double trouble for kidney health. Visual showing concentrated urine increasing stone risk when nuts are consumed without fluids. Gut microbiome and oxalate breakdown from nuts. Image showing Oxalobacter formigenes or absence of it, affecting oxalate handling from nuts. Almond milk versus whole almonds. Oxalate levels explained. Comparison infographic showing how nut processing may affect oxalate levels. Snack habit versus kidney health. Frequency of nut intake and stone risk. Chart showing how regular nut snacking correlates with increased urinary oxalate. Calcium oxalate, kidney stone with nutshell overlay. Artistic medical image blending a kidney stone crystal with cracked nutshells as symbolism. Before red meat and organ meats and kidney stones purine breakdown pathway leading to uric acid flowchart, showing how purines in red and organ meats are metabolized into uric acid. High purine food chart, red meat and organ meats ranked bar graph ranking. Beef, liver, kidney, and processed meats by purine content. Liver steak with a magnified purine content label image, showing a plate of organ meat with biochemical tags for purine and uric acid potential. Uric acid crystal formation in kidneys. Illustration showing needle-like uric acid crystals forming in renal tubules. 3D model of a kidney stone labeled uric acid origin from meat. Visual of a reddish stone with metabolic pathways annotated around it. Blood pH and uric acid solubility chart graph showing that acidic urine, common with high meat diets, promotes uric acid stone formation. Meat-heavy diet versus plant-based diet. Urine pH comparison. Infographic showing how red meat lowers urine pH, increasing stone risk. Kidney cross-section showing dual pathways. Calcium oxalate and uric acid stones. Ammonia and urea production overload from high protein intake biochemical pathway, showing how excess nitrogen from meat stresses kidneys. For 5 sodium, salty foods, and kidney stones. For video content scene, table full of salty foods with sodium symbols floating above. Include chips, canned soup, fast food, deli meats. Highlight Na+ symbols rising from them. Animation frame, sodium. Increasing calcium excretion in the kidneys diagram of nephrons, showing sodium reabsorption causing calcium to be dumped into urine. Labeled cross-section of kidney with calcium oxalate stone forming due to high sodium stone forming in renal pelvis, with sodium shown driving urinary calcium levels up. Infographic style clip. High sodium, occurred high urinary calcium, ARC kidney stone. Simple cause-effect flowchart visual in motion. Graph, urinary calcium levels versus sodium intake line graph, showing how higher sodium intake corresponds to increased calcium loss in urine. Scene, salty fast food versus fresh food. Kidney health. Comparison split screen showing 2 diets and long-term kidney effects. Zoom in animation. Calcium oxalate crystal forming in urine after salt-heavy meal. Particles clumping together in animated urine environment. Visual overlay of sodium and calcium. Ions in renal tubules, floating ions in motion. Sodium pushing calcium into urine. Before and after kidneys. Normal kidney versus stone-affected kidney under high sodium diet. Illustrate damage or buildup of stones after years of excess salt. Animated character drinking soda and eating chips. X-ray shows crystal formation. Use storytelling to show lifestyle's invisible internal impact. Microscopic close-up. Calcium oxalate crystals growing over time in salty conditions. Animated timeline of crystal growth inside kidney. Did you know? Pop-up. 1 teaspoon of salt. Risk factor for stone. Text overlay animation with a salt shaker visual and a kidney in the background. Aging clock and kidneys showing gradual buildup of risk. Sodium intake meter. Green, safe. Red, danger zone. Dial style visual showing dietary sodium levels and associated stone risk. Gut to kidney animation. Sodium travels through body and impacts calcium handling, digestive and circulatory.